Well, along with protests against police brutality and racial injustice breaking out across the country, Black journalists are also documenting the disproportionate impact of COVID-19 on the African American community. With more than 6 million confirmed coronavirus cases worldwide and over 104,000 deaths in the U.S., COVID-19 mortality rates are about 2.6 times higher for African Americans than for whites in this country. So, one Black journalist says that the steady stream of negativity has been particularly exhausting for Black journalists. Her name is Patrice Peck. She's going to join us now. Patrice, you actually started a newsletter that was specifically telling stories about COVID-19 and the African American community. And I really like the fact that you focused on stories that some are not being told, like frontline workers, not just doctors and nurses who are Black, but also people who work in stores or public transportation. Why did you think it was important to start this newsletter?
Yeah, so I launched coronavirus news for Black folks. I launched it on April 5th. So this was about a week before um, the CDC, um, sorry, it was about a week before a lot of national publications started to tell their readers that Black people were being disproportionately impacted by COVID-19. Um, I knew this was going to be an issue because, it's an unprecedented disease. As a journalist, I was constantly trying to get more information on it. And once I learned about the high risk factors, which included pre existing medical conditions, I understood that the Black community was definitely going to be, hit especially hard because of a history of pre existing medical conditions in our community, which, as you mentioned, is deeply rooted in systemic racism and other health disparities.
Hmm. One of the things that I find remarkable, especially in recent years, is in talking to my fellow reporters who are Black and who specifically cover race in America and how structures affect race in this country, whether criminal justice or medical, is that I noticed that, and I'm not a doctor, but I've noticed that they are exhibiting, in some cases, some of the signs that I've seen from journalists who cover wars in other countries. That we're seeing the same level of stress, the same level of exhaustion, almost in some cases. And again, this is not a clinical diagnosis, but PTSD that you see of journalists who have covered the worst tragedies in human civilization, like the massacres in Bosnia or in Rwanda. You wrote an article in the New York Times titled "Black Journalists Are Exhausted." Take me through that.
Yeah, so I'm a Black journalist, and I was and still am exhausted. I pursued journalism because I wanted to, create a voice for the voiceless in my community. Historically, Black people have not been covered accurately or fully or comprehensively by historically white staffed publications. Um, on top of that, the media industry is has been severely disrupted for the past several years, resulting in tons of layoffs. Black publications have been folding or are under resourced and understaffed. So, there's it's exhausting. We are Black journalists. We're covering those of us who are covering racial inequities. That is something where we are covering um, things that we experience, right? Journalists do not live in a vacuum. We experience the same things that our Black peers experience day to day. And that includes discrimination, racial bias, racial profiling, um, systemic racism as a whole, right? And so, on top of that, if we're reporting on racial inequities, oftentimes that comes with trolling, right? We get harassed online, particularly Black women. Um, the police have been targeting the media. We saw the CNN journalist Omar Jimenez got arrested despite having his credentials, got arrested on live television. Um, and like you mentioned, we're stressed, right? And that stress compounds, and it makes us even more vulnerable to contracting this disease. that is already disproportionately impacting our community. Sorry. um,
No,
yeah, it's
you're
a
making
lot.
great points.
Yeah, thank you. Yeah, it's a lot, and we are reporting on the deaths, the police killings that we have experienced. Like I mentioned in my essay, it's day after day, sometimes hour after hour. The incident with Amy Cooper calling 911 and falsely accusing Christian Cooper in Central Park, that happened or that the video came out a few hours before the video came out about George Floyd being killed. So that was back to back on top of the coronavirus, right? So it's been a lot.
Yeah, I think the point that you're really making very clearly is that we are journalists, but we are also people. So when the
Yeah.
story is the coronavirus is impacting African Americans, it means it's impacting us as well. It means that chances are we know someone who has the disease. We may know someone who has passed away. I know people who have lost their parents, unexpectedly because of the coronavirus. When you look at the video of Amy Cooper in the park, inevitably you look at it as a journalist, but then you also think to yourself, boy, my nephew is, a young black man. What would it be like for him? You can't help but to sort of personalize and be of two minds when you cover this sort of stuff, and it is exhausting. And you write about the desire and the need for newsrooms to be diversified, but just having numbers-wise a diverse newsroom and diverse inputs editorially isn't enough, because you need to sort of get past the gatekeepers. If people don't know how sort of newsrooms work, you pitch a bunch of stories, a bunch of people are pitching stories, but only a handful of people are sort of making the final decision as to what makes it into a paper or on a website or on air.
Yep. Yeah, exactly. And, in terms of pitching, so I'm freelancing right now. I began freelancing after leaving my full-time job last fall because I really wanted to address stories that covered the Black community. And, but I have worked in predominantly white companies, media companies. And, if let's say you're working with a white editor or a non-Black editor to whom you have to explain the significance of a story that you might want to cover that addresses the Black community, that's going to look very different when you're at a predominantly Black media company, right? And most, if not all, of your team members are going to already sort of be up to date with at least general news and stories happening in the Black community. So that's another factor in terms of having to explain yourself, and sometimes having to explain sort of the humanity at the center of the story. There's also tons of racial microaggressions and macroaggressions also that still happen in newsrooms. Newsrooms are not within a vacuum. The same thing that happened to Christian Cooper could easily happen at a media company. I've seen several Black journalists tweet that Amy Coopers also exist in media companies. And as you mentioned, we're underrepresented. Uh, and that includes in upper level management and in executive levels. So it's a lot we're facing from our own industry on top of, out in the protests in terms of what we're covering, or in terms of, publishing our things online, and again, receiving trolling comments, or even from the White House, who has been attacking journalists this whole administration. It's just a lot of layers compounded on top of one another.
Mm-hmm.
It's a really important discussion, and we're so happy that you were able to join us to talk about this, Patrice. Patrice Peck, thank you very much.
Thank you for having me.